Hi, my name is Grant Fleming. I'm going to be doing a peripheral IV start in DC or discontinuation. The case right now is where we don't have an IV bolus or tubing. We're just going to be starting the IV. But in the case that we did have those, we would inspect the IV solution for any damage to the packaging and check the expiration date. Open the packaging from the slit. You're going to tear down the side and you're going to look at the bag and check for cloudiness or particulate matter within the contents. You want it to be clear without any particulates within the solution. You're going to then label the solution with the patient's name and birth date along with my initials, and then you're also going to label the bag with the medication, the dosage, the drip rate, and when it's supposed to start and finish, so that anybody that sees that will know what is in the bag and how fast it's supposed to be going and when it's supposed to stop. So then after you've examined the medication, you're going to get your IV tubing and you're going to label it with the date and time and initials, and you're going to take the tubing out of the packaging, uncoil it, and you're going to inspect it for any damages, and then you're going to leave the spike cover intact, and you're going to take the stopper out of the bottom of the solution bag and you're going to pull that out, and you're going to take and remove the spike cover, and you're going to insert it holding both of them firmly and sliding it into the bag in a twisting motion. And then you're going to prime the tubing, allowing the fluid to flow just till it gets to the end of the tubing and begins to flow from the tubing, and you're going to close the roller stop so that you don't pour out your medication. And you're going to hang that bag, and you're going to leave it so that it is out of the way while you start your IV, but it's within reach so that you can hook it up to your IV site once it's ready. So we're going to go ahead and we're going to talk to the patient, let them know what we're doing and what they can expect to happen, and if the patient has any questions, they can ask those at this time. We're going to ask the patient what their name and date of birth is according to their wristband. Make sure it's the right patient that we are putting this medication into. So what is your name and date of birth?
Rachel Fleming, 8/15/1985.
Perfect, thank you. And so we're going to let her know that we're going to be doing a peripheral IV start. I'm going to be putting it in her median antecubital vein, and she's going to have a tourniquet put on. She's going to feel a quick poke when the needle is about to be inserted. And so we're going to start. We're going to put this towel underneath the patient for cleanliness and to save the linens from getting any blood on them. I'm going to put this tourniquet on to inspect the site for a good vein for IV insertion. The IV needle is going to be inserted. We're going to have a distance of about 5 to 8 centimeters from the IV site to the tourniquet, or 10 to 20 centimeters, sorry. And so the IV site, we feel here, we have a great vein right here in our arm. We're going to feel the radial pulse, still have a radial pulse. If the patient's arm was excessively hairy, we would remove the tourniquet, shave the arm, and reapply the tourniquet. At this time, we're going to clean the arm with a ChloraPrep cleaner with alcohol in it. We're going to start at the insertion site, and we're going to go in a circular motion outward once cleaned, we're going to discard the cleaner and we're going to allow that to dry. We're not going to fan it or blow on the site. We're going to let it to air dry. The site is now ready to go. We'll have put on our procedure gloves to maintain safety for ourselves from any bloodborne pathogens that this patient could have. We have our items ready to go. We're using a 20 gauge needle with a over the needle catheter. And so in this case, I'm not actually going to poke the patient. I'm going to put the IV up to the site. I'm going to retract the needle, and my patient is going to, or I'm going to hold the IV catheter in place as if it was in the patient's arm, in their vein. We also have our flush with our cap on the flush, and so the site has dried and is cleaned and prepped for IV insertion. I'm going to go ahead and insert our needle. I'm going to hold the skin tight so that the patient does not, so that the veins don't move as easily. I'm going to insert our IV, and the blood will flow up the needle and it will flash into the barrel of the catheter so that we know that we're in the IV. We're going to advance our catheter into the vein, and once the catheter is in the vein, we're going to retract our needle, and we're going to occlude the vein upon retracting the needle so that there's no bleeding. And we're going to put our flesh and cap onto our IV, and so it is prepped and on there. I'm going to slightly aspirate the vein to make sure that we are truly in a vein and not arterial, and then I'm going to flush it to make sure for patency of the vein, and then I'm going to hold by the hub and remove my syringe holding this secure. I'm going to go ahead, now that I know that the IV is a patent IV and it aspirates and it flushes, we're going to go ahead and we're going to secure the site, and we can now remove our tourniquet. After, if we needed any lab draws at the time, we would have drawn those. I'm going to put our Tegaderm on this site. This specific Tegaderm has a window over the insertion site, and it wraps around and hugs the IV, and we have this second piece of tape which goes underneath the barrel of the hub, and it holds the IV a little bit more secure. And then upon finishing that, we're going to label this IV with the catheter size, the date, my initials, and letting them know what time it was put in so that it can be changed on a regular basis correctly. So we're going to go ahead and we're going to place that right here on the side so that anybody that sees this IV will know what it is that they're seeing. And if there was any blood, we'd go ahead and we'd clean that. We'd go ahead, if the end of this hub had been touched, we're going to wipe it off with an alcohol wipe. We're going to hook our tubing up, and we're going to begin the proper flow of medication, and ask the patient if they're comfortable, and if they need anything, return them to a position of comfort, and clean up our supplies, put our sharps in the sharps container, and throw away any of the garbage that we have laying around from our procedure. And then we're gonna throw our gloves in the garbage as well, and wash our hands. Thank you.